Here we are with chapter 9, and this is going to be the minerals essential for calcified structures. So calcified structures in the body are composed of a matrix of organic and inorganic substances. Essentially, it is the mineralization of the deposition of inorganic elements or minerals on an organic matrix. So think about it like how the plaque forms a matrix and then calcium and phosphorus come along and calcify it, right? That's how almost all of the calcified structures in our bodies are formed. Collagen is pretty important because it's present all throughout the periodontium as that primary connective tissue fiber. It's the actual major organic constituent of alveolar bone as well. So collagen is pretty important for us. The organic matrix of bone is 90 to 95% collagen fibers. And that formation of collagen requires protein as its base, right, forming the matrix, and then vitamin C, iron, copper, and zinc. Once the collagen is formed, then the mineralization can begin, right? So we add mineral in order to mineralize the collagen. Calcium reserve, typically there's between 0.4 to 10% of total bone calcium in shapeless or amorphous form. Okay, so teeth are composed of 3 calcified structures. This feels a little silly to tell you, but it's enamel, dentin, and cementum. I feel like you probably know this by now. Approximately 30% of dentin, 50% of cementum, and 35% of alveolar bone is organic, which means the rest of each of those structures are inorganic. Dentin contains the same constituents as bone, but its structure is more dense, the same as cementum and essentially enamel. Cementum is another bone-like substance, but because it contains fewer minerals, it's softer than bone. The development of normal, healthy teeth is affected by metabolic factors, such as parathyroid hormone secretion, or PTH secretion, the availability of calcium, phosphate, vitamin D, and protein, and other nutrients as well. The actions in which pressure attempts to diminish a structure's volume are referred to as compressional forces, or tensional forces are actions in which pressure stretches or strains the structure. So minerals are inorganic elements that have a lot of physiologic functions, right? Inorganic elements in your body will account for about 4% of your total body weight, or if you weigh 150 pounds, that's about 6 pounds of the total weight. Minerals can be subdivided into 2 categories, major and minor, go figure. You can see this in box 9.1 in your book. Actually, that's adequate intake. I'm sorry, I'm looking at the table. So on page 160, box 9.1, mineral elements in the body, you'll see the major minerals, the trace minerals, and the ultra trace. Moving right along to calcium, we're still on page 160 in your book. The physiological roles of calcium are that it is the most abundant mineral in the body, and 99% of your body's calcium is going to be kind of locked in to your skeleton and your teeth. The functions of calcium are, well, obviously bone health, but also it's going to assist in blood clotting. It helps to transmit nerve impulses, muscle contraction and relaxation, membrane permeability, activate certain enzymes, and it helps as that salivary calcium to buffer some of those acids that are in the mouth. Saliva is actually super saturated with calcium, so that saliva is a source of calcium to mineralize an immature or demineralized enamel surface, and it's going to reduce the susceptibility to caries. So what does that mean? It means that you have a lot of calcium in your saliva, and that calcium is going to help to remineralize the areas that are beginning to break down. Both calcium and phosphate in saliva provide a buffering action to inhibit caries formation. What that means is the calcium and the phosphorus help to bring that pH level back up above that 5.5. All right, so the requirements of calcium. The recommended dietary allowance for calcium is going to be 1,000 milligrams per day for individuals between the ages of 19 to 50. During growth periods, so anywhere between 9 to 18 years of age, the requirement is even higher than 1,000 milligrams a day. Peak bone mass occurs sometime between 18 to 25. What does that mean? It means you stop growing sometime between 18 to 25 years of age, which means that you no longer need the additional calcium to assist your bones to continue growing. National Academy of Medicine recommends a dietary intake of 1,200 milligrams a day for females over the age of 50. And they do this because of the increased risk of osteoporosis for women. We're going to talk about that. Women are less likely than men to exceed their RDA. I'm not really sure why women eat less calcium than men do, but I guess they seem to. You can see this information on the actual table 9.1, which is still on page 160 at the very bottom. Inadequate calcium intake can be attributed to a couple of different things. So uninformed choices or not selecting adequate amounts of calcium on a daily basis, right? This is either people don't know or they just don't care how much calcium they're supposed to be eating every day because they don't understand how important it is. The mistaken belief that adults do not need milk or that milk contributes too many calories to the diet. So, milk is kind of considered the best source of calcium for humans. And you can also find, like if you don't want milk or you don't like milk, there are other sources like soy milk or almond milk that are fortified as well that you can get this kind of thing from. But I don't necessarily subscribe to the idea that you need milk specifically. Milk is a really good source for calcium because it's a little bit more bioavailable, but we'll talk about that. Economic hardships. These are just people who have a hard time affording foods that are nutrient dense and therefore calcium dense. A lack of knowledge regarding inexpensive sources of calcium-rich foods. So when, maybe someone can't afford a gallon of milk, but they could afford something less expensive that would have calcium, they just don't know. And then lactose intolerance or allergies or choosing not to. Access to and consumption of soda. This one we see more so like in teenagers and kiddos. As they're growing up, sometimes they turn to soft drinks instead of milk. And then the dislike of calcium-rich foods. I don't know anybody who dislikes, I don't like milk, but I don't know anyone who specifically is I don't like the taste of calcium. I've never seen that before, but maybe people think that milk is the only source of calcium and therefore they don't like milk and then they just write calcium off entirely. I'm not really sure about that one. Generally, an inadequate calcium intake will affect bone mass more than tooth structure. Typically the calcium that's in our teeth, except for acid, is kind of locked in. We can't lose the calcium that's in our teeth. But the calcium that's in our bones, especially the longer bones, it's a little bit more fluid. It can go in and out of the bone. Whenever the blood calcium, the serum calcium, levels are kind of fluctuating, it can be released back into the blood system. So teeth don't work that way. All right, so we were just talking about that a little. Cerium calcium is the amount of calcium that's kind of floating around in your blood, and it needs to remain relatively constant. So whenever you need more calcium, your body will use it wherever it's needed, so then it will just kind of pull calcium. Either it will absorb a little bit more calcium from your diet, although not always. If it's available in your diet, then it will pull calcium from your bones. This happens a lot with women when we're pregnant. If you don't have a very good calcium source in your diet, then you're gonna lose some calcium in your bones. When calcium withdraws from bones, exceeds deposits, a calcium imbalance occurs. Go figure. Serum levels of calcium and phosphorus are inversely related. So if you have a lot of calcium in your blood, then the amount of phosphorus will go down, and vice versa. And then if calcium levels increase, phosphorus levels decrease. I just said that one. They're inversely related. That's what that means. So your calcium balance isn't solely depending on you eating enough calcium, right? There are other factors like hormones, your parathyroid hormone or PTH. Estrogen plays a pretty big role. This is why women are so prone to having low calcium. Glucocorticoids and thyroid hormone are all going to help to regulate that calcium absorption. And so you can be eating enough calcium, but if your hormone levels are off, you may not be absorbing the calcium that you're eating. Under normal circumstances, less than 1/3 of calcium is absorbed whenever it is consumed. So let's say you ate your entire 1,000 milligrams of calcium in one meal. I'm not sure how you would do that, but maybe you like that. And so in that sitting, you're actually only going to get, the 300 milligrams worth of it. So you can eat the whole amount, but you're not going to absorb all of it. You can only absorb so much of it at a time. So what they recommend is to have about 30%, or that 300 milligrams per serving, 3 or 4 times a day. That way, you're kind of spreading out that absorption over time, and you'll be able to absorb more of it overall. Maximum calcium absorption occurs when it's consumed in those smaller amounts. Absorption occurs in the small intestine, like most things, and then phosphorus increases uptake of calcium by the bone. So if you have the phosphorus in your bloodstream, it's going to help that calcium be absorbed by the bones and kind of stay sort of locked away. The sources of calcium are going to be milk and dairy products, and this is the preferred sources of calcium because of high calcium, lactose, and other nutrients content are going to enhance calcium absorption. So when you consume milk, you absorb more of the calcium in it than you would in other calcium sources. Fortified soy and rice milk will have sources of calcium. Other fortified foods like orange juice, some cereals and things like that, they're fortifying with. And then supplements. Supplements aren't the best. You kind of hit or miss with how much of a supplement you're going to truly absorb because it has very limited bioavailability. It's better absorbed when you take it with food. And then the calcium citrate malate, calcium lactate, calcium citrate, calcium sulfate, they all have high absorption rates. So it just depends kind of on what you get and how you eat it and how often you eat it. And there's a lot having to do with the way that absorption works. So food labeling is discussed in table 9.3. This is on page 163 down at the bottom. Bioavailability is going to refer to the amount of nutrient that is available physiologically and is based on its absorption rate. So bioavailability has to do with, okay, I put this into my body and then my body decides how much of it I'm going to get, right? So I can control how much of it I put into my body, and then I don't get to necessarily control how much of it I absorb, but the amount that truly does get absorbed, that was the bioavailable part. All right, so hyper states of calcium, hypercalcemia or excess calcium levels in your blood. This is pretty rare. It doesn't usually happen from eating too much calcium. What happens is you get way too much vitamin D. And so when this happens, you'll have hyperparathyroidism or an overdose of cholecalciferol or vitamin D poisoning. Excessive calcium intake will result in dizziness, flushing, maybe that's like the blood rushing to your face, nausea, vomiting, severe constipation, kidney stone formation, this one is a pretty common one, irregular heartbeat, tingling sensations, xerostomia, fatigue, and high blood pressure. It can also, and probably will, inhibit your iron and zinc absorption. So if you're getting way too much vitamin D and calcium, you're not going to be getting as much you're not going to be getting as much iron and zinc. The other thing, as far as dental hygiene related goes, they don't talk about it a lot with kidney stone formation, but also those tonsillar stones, those are pretty closely linked to the same sort of structure as a kidney stone. So it's just kind of that extra calcified structure. We'll talk about it probably a little bit more in the soft tissue sort of section, but tonsillar stones are also a calcified structure. Moving along to phosphorus. Phosphorus is the second most abundant mineral in the body. It makes up about 85% of it is kind of stored away in the skeletons and teeth. The functions of it are going to be for formation of bones and teeth, muscle contraction and nerve activity, component of phospholipids in cell membranes, DNA and RNA, energy metabolism, so it is a part of the adenosine diphosphate, right? Obviously phosphate, phosphorus, all the same, and a buffer for the body. So this is going to help to buffer some of that acid. So phosphorus helps to regulate the acid-base balance that's in the body. It's pretty important. So men and women over the age of 18 are encouraged to get about 700 milligrams a day of phosphorus, and it is absorbed, about 60 to 70% of dietary phosphorus is going to be absorbed, and it's going to happen in the jejunum. That's a fun word to say. And then the sources are pretty much everything. Most foods have phosphorus in them. The deficiencies are very rare because of all of the amazing sources that have phosphorus in it. And it's not all animal products or all plant products. It's a good range of both. So although harmful effects from excessive amounts of phosphorus haven't really been reported, there is an established tolerable upper intake level, and you can find this on table 9.4 in your book. Oh, also, kidneys excrete excessive amounts of phosphorus in order to maintain optimum body levels. So, if you're consuming a lot of phosphorus, which you probably are because it's in a lot of foods, your kidneys can excrete it pretty easily. Hyper and hypo states of phosphorus. So hyperphosphatemia, where the serum level is above 2.6 milligrams per deciliter, can occur in hypoparathyroidism and renal insufficiency. Your book also talks about excessive amounts of phosphorus are going to bind with calcium, and that's going to result in tetany and convulsions. So tetany is like a very, very small amount of calcium, and you need the calcium in order for your bones and your nerves and things like that to work properly. So you'll get a lot of like spasms and pain from being super low of calcium. Because remember, we have our calcium phosphorus balance. So whenever we have a ton of calcium, we have low phosphorus. So inversely, if we had a ton of calcium, we would have a very low amount of if we had a lot of phosphorus, we'd have low amount of calcium. Hypophosphatemia can occur with long-term ingestion of aluminum hydroxide antacids, which bind phosphorus. So if you're someone who has a lot of gastrointestinal upset and you take antacids that have aluminum hydroxide, obviously, then it could bind the phosphorus, and that could be bad for you. And then it can occur in some stressful situations where stress will kind of block some of the absorption here. And then also in absorption conditions where, like sprue and celiac, where the absorption of phosphorus, there's some kind of issue in the gastrointestinal tract where it doesn't absorb things like it should. Excessive amounts of phosphorus will bind with the calcium, resulting in tetany and convulsion, which we talked about. During tooth development, phosphorus deficiency can result in incomplete calcification of teeth, failure of dentin formation, and increased susceptibility to caries. So anytime we're low on something that is a calcified structure, it's going to make patients more susceptible to getting cavities because their enamel isn't and their dentin aren't as strong. As far as the physiologic roles of magnesium, the bones are going to contain about 2/3 of the body's magnesium. The rest of it is free floating. It has a role in bone and mineral physiology. It is a cofactor for more than 300 enzymes, so it's probably pretty important. Necessary for DNA and RNA synthesis. It's going to regulate the transmission of nerve impulses and muscle contraction. It's associated with vitamin D conversion in the liver. It's going to facilitate blood clotting, and it's going to facilitate that parathyroid secretion. So some of those enzymatic reactions are going to include energy metabolism. Of course, that's like a bunch of enzymes, insulin activity, and that glucose utilization. Some research studies have suggested that lower intakes of magnesium may lead to insulin resistance and or type 2 diabetes. So they definitely see a connection between getting a sufficient amount of magnesium and your hormones and enzymes working the way that they're supposed to. All right, so ranges are going to be from 240 milligrams per day in 9-year-old children to 420 milligrams per day for men. So I'm guessing as long as you fall somewhere in between the two, you're going to be okay. Sources of magnesium are going to be in dark green leafy vegetables. I don't know if you've noticed, but dark green leafy vegetables have been kind of a source of everything. They are cram-packed with goodies for you. So eat your green leafy veggies. Whole grains and nuts, chocolate, and bananas. Wow, this is probably one of the most interesting food sources around. Non-food sources for magnesium will include laxatives and antacids. So we see those in patients who take those things. They can get some magnesium from them as well. You can see in your book tables 9.5, which is on page 166 down at the bottom. It has that EAR, RDA, and AI. And then table 9.6 has that magnesium content of some selected foods. So it looks like sesame seeds is a pretty good source for magnesium. And then figure 9.3 shows you that chemical structure right here. This is the chemical structure of a chlorophyll, but you can see how magnesium is really the center of this structure. And so when you eat dark green leafy vegetables, which the more green vegetable is, the more chlorophyll it has. And so that is why. That's why that works that way. As far as hyper states of magnesium goes, we talked about how the kidneys will, kind of very easily excrete any extra. Well, if you have too much magnesium, but your kidneys aren't working properly, then you're going to build up an excess of magnesium, and the toxicity can cause kidney failure. Like if your kidneys not functioning properly, but you eat too much of this, then they'll kind of work against one another. Symptoms of too much magnesium are going to be diarrhea, nausea, and cramping. You're probably not going to know what's wrong with you. You're probably going to go to the doctor and they're going to take blood and then they'll figure it out that way. As far as hypo states of magnesium goes, it's a pretty rare deficiency in healthy people. Most healthy people hold on to the magnesium that they need. It can occur with prolonged vomiting, malabsorption, kidney disease, intestinal surgery, excessive use of over-the-counter and prescription medications like corticosteroids and diuretics. It is present in nearly all chronic alcoholics. The reason for this is because alcohol is kind of a diuretic and it will cause you to flush out all of your liquids, which will take some of the magnesium with it. Symptoms of deficiency are going to be the fragility of alveolar bone and gingival hypertrophy, cardiac dysarrhythmias, and neuromuscular hyperexcitability. All right, and your book is going to include fluoride. This is really exciting because fluoride is so essential. It's not essential for health, like you don't need it to live, right? But it is a very important structure as far as our teeth goes in our calcified structures. So it doesn't have a metabolic function, but it does have a physiological function. Because of the benefits to dental and bone health, fluoride is considered a desirable element for humans. Fluoride ions can replace hydroxyl ions in the hydroxyapatite crystal lattice, making it more resistant to caries. So when the tooth is beginning to demineralize and the hydroxyl ions kind of break off, then the fluoride ions are attracted and they will bond, and then they will attract more calcium and phosphorus. All right, so once it binds, right, it's no longer hydroxyapatite anymore. It's now fluoroapatite or fluorapatite. And it is more caries resistant than it was whenever it was, not bonded. Systemic fluoride results in changes to tooth morphology, increases tooth resistance to adherence of plaque biofilm. So what this means is the more fluoride you have, the more smooth your enamel is, and the more your tooth is resistant to biofilm. Fluoride in your saliva also interferes with the demineralization process. So the fluoride will bond, interfere with the demineralization, which will then promote remineralization. Primary teeth benefit from the presence of fluoride during tooth development beginning at 6 months of age, and this sort of process ends once all of the teeth have fully erupted into the mouth. That maximum protection of fluoride against caries is going to occur between the first 6 to 10 years of life. So once most of the teeth have erupted, then the maximum effect kind of goes away. Systemic fluoride uptake by calcified tissues is high from infancy until about 16 years of age. Part of this is the reason is because fluoride will bond to any areas that are lower in density. So bone, like the epiphyseal plates, it will bond there as well and helps to strengthen some of your other bones. Higher concentrations of fluoride intake are going to inhibit the Streptococcus mutans, Streptococcus sobrinus, and the Lactobacillus species, which of course we know S. mutans and Lactobacillus are the main causes of dental caries. And then it's going to stimulate osteoblast proliferation and increase new mineral deposit in cancellous bone. So as far as the bone level goes in our alveolar bone, it's going to stimulate the cells that make bone, and that is going to make bone. Pretty simple. So fluoride works with calcium and phosphorus. The three of them together are very efficient at remineralizing things. In your book, you can refer to table 9.7. You can see there the National Academy of Medicine recommendations for fluoride, for how much a person should get, and then that upper limit as well. The adequate intake of fluoride is 3 milligrams a day for all women and 4 milligrams a day for all men. The average intake right now in the United States is 0.9 milligrams per day, although your book was written a few years ago. The upper limit for health individuals, healthy, I'm sure is what that's supposed to say, between the ages of 9 and older is going to be 10 milligrams a day. So you don't want more than 10 milligrams a day. And that is from all of the sources of fluoride. So, your systemic fluoride, any fluoride rinses you might use, toothpaste you might use, anything like that. Any and all sources, even food has fluoride in it. So be careful if you're someone who does a lot of that. Most absorption occurs in the stomach, and then the rate and degree of absorption depends on the solubility of fluoride and the amount ingested. So what this means is that if your fluoride is in a food that has a lot of protein in it, you probably won't absorb very much of it. But if your fluoride is in your water, then it's probably going to be absorbed much better. Absorption from sodium fluoride in water is estimated to be at about 50 to 80% of the fluoride that's kind of taken in. That is what you absorb, which is a pretty good amount to be absorbed. I read once that the water fluoridation, as long as it's at the appropriate amount, which here in San Antonio is 0.7 parts per million, as long as it's at the appropriate amount, then you're consuming, many multiple sources of fluoride, the fluoride in your water is going to give you about 25% of your overall protection from cavities, and then your topical fluoride and your oral hygiene is going to give you that other 75%. So I don't know, I think that's pretty interesting. So a varying amount of fluoride intake is excreted by the kidneys because that also depends on the physiologic need. So if you need fluoride, your body will hold on to it. But if you don't need it, what's nice is it will just let it go. As far as sources of fluoride goes, obviously water fluoridation has been kind of touted as the most successful public health initiative. I mean, I can't argue with it. It's recognized as one of the most important public health measures, and it's pretty cost effective, and it's pretty practical, and it worked. Approximately 74% of U.S. has access to optimally fluoridated drinking water. The Healthy People 2020 goal was to get 79% of the U.S. up to that optimally fluoridated drinking water. Say that 10 times fast. So some of the sources for fluoride are going to be seafood as well, brewed tea, because they use fluoridated water when they brew tea, and then carbonated beverages if water in the bottling process is fluoridated. So this is important. If you are drinking bottled water, then so they have to say they put fluoride in the bottle if they add the fluoride specifically. They don't have to say if there was fluoride in the water before they bottled the water, then they don't have to tell you that there was water. Although, because the FDA supports fluoride as an initiative to prevent cavities, they are allowed to say, if there's any fluoride in the water, they're allowed to say that fluoride is a part of, drinking fluoridated water may reduce the risk of tooth decay. You'll see that on page 169, like in the first paragraph on the far right. So other sources of fluoride, as we know and love, are going to be topical, right? The gels, foams, varnishes, dentifrices, prophylactic pastes, and mouth rinses. these are all of the sources that we get to talk and educate our patients about. So these are a much higher concentration of fluoride, and they do the best when it comes to preventing that demineralization of the oral cavity. So systemic is great, but once it kind of is swallowed, it's not super helpful for our teeth anymore. We really want to focus on topical fluoride that's going to stay where we put it for a little while until it can be fully absorbed. So as far as hyper and hypo states of fluoride, dental fluorosis or hypomineralization of enamel is directly related to fluoride exposure during tooth development. And there is a range here. It varies from those white flecks on the teeth all the way up to like brown staining, that mottling, brownish discoloration, and the varying degrees of enamel pitting. Now, typically when someone has dental fluorosis, they actually will be less prone to getting cavities if their enamel formed properly and they had fluoride, right? Then they'll be more like less susceptible to cavities. But sometimes what looks like dental fluorosis is actually just a different type of hypomineralization. And so it could be, vitamin A deficiency or something like that that's causing that sort of appearance. And so you don't want to automatically assume that the person no longer needs fluoride. Just because they have dental fluorosis is not necessarily a reason that you shouldn't be doing fluoride or they shouldn't be using a fluoridated toothpaste. That doesn't mean the same thing. And then ingestion of large amounts of fluoride in adults can result in adverse effects on skeletal tissue and kidney function. So this is what we see when patients, they might be opposed to fluoride, which we'll talk about. But if you eat a ton of fluoride and you ingest it, then it can't be good for you. You can look at figure 9.6 in your book. You'll see those varying degrees of mild fluorosis, moderate, and severe fluorosis on the bottom there. All right, and then on the flip side, a lack of fluoride or a hypo state of fluoride is going to result in dental caries, as we know very well. So that lack of fluoride is going to result in increased dental caries. Protective effect against caries is greatest during tooth formation. So before the tooth erupts, that's when systemic fluoride is going to be the most effective. And then the continued use of fluoridated water by adults is beneficial, which I told you is about 25% of their overall protection from cavities. So the American Dental Association, the ADA, and the American Academy of Pediatrics recommend exposure of teeth to fluoride until calcification of teeth is completed. That's around 16 years old, which is why, I don't think it's fair, but that's why dental insurances kind of stop covering fluoride at 100% for kiddos. Usually it's around 14, sometimes it's 16, because of the ADA coming out with that statement right there. So the safety of fluoride. Every so often I come across an article that's talking about the safety of fluoride, and there have been a lot of claims as to fluoride causing cancer and AIDS and Alzheimer's, mental illness, infertility, Down syndrome, lowered IQ in children, and there just simply isn't enough scientific evidence to support those allegations. A lot of those types of claims come from like anecdotal kinds of statements. So someone tells a story of what happened to someone else that they knew. It's never them. It's always like someone who knows someone, right? And so you can't necessarily throw out the baby with the bathwater here. Like, just because someone got sick because they had too much fluoride doesn't mean that the right amount of fluoride for most people isn't still beneficial, okay? I just want you to be really mindful that we wouldn't be putting fluoride in everybody's drinking water unless it had been thoroughly tested. There's been a handful of communities here in the United States that have actually banned the addition of fluoride. Some people are running campaigns of anti-fluoridation, so they want to remove fluoride from a lot of the water systems because of how they feel about this kind of thing. And I'm not sure how that's going to go. I don't think that it's going to be a good thing, and I worry about the kids who live in the communities that don't have a choice, because it's not the people, like, it's not, well-off people's problem if the fluoride comes out of the water. They can afford toothpaste and dental visits to tell them when they have an incipient caries, but the kiddos who don't go to the dentist, and they drink water at school and they eat lunch at school, and like, those are the kids who really needed it, and those kids are the reason the fluoride got put in the water in the first place. So you just have to really think about that. If you're someone who is doing okay and you don't feel comfortable with the fluoride, then go ahead and get a filter and filter it out. But the fluoride is there for a reason. So this is the end of chapter 9.